Wel, helo baw, sut wyt ti? Hello everyone, how are you? Gobeithio'ch eich bod chi gyd yn ddiogel ac yn iach gwaethaf yr amseroedd hiriol hyn. Hope everyone's keeping safe and well. These are challenging times, difficult times for all of us, and I hope that you're all doing well. The reason for this introduction, for those of you who don't know me, I'm Professor Mark Llewellyn. I'm leading the team of academics and expert advisors who are evaluating the Social Services and Wellbeing Act. The purpose of the video is to introduce a narrated presentation, which will follow, which provides for you an insight into the findings from the process evaluation phase of our work. The process evaluation is focused on hearing the voice of the workforce. There'll be a phase of work through 2021, which then focuses attention on service users, carers, families, and others. The presentation is quite lengthy. There's a lot of material that we needed to cover, but feel free to skip through it as you want, pause and reflect on parts of it if you choose to. We will be proceeding to run a series of events following this, more detail of that at the end. I'm hoping you've had email contact from us to explain what the meetings will cover. Anyway, I'll say no more and leave you to hear the presentation and catch back up with you on the other side. Diolch. Thanks. So it's important to say at the outset of the presentation that this is the process evaluation phase of the study. It is drawn from the workforce perspective. The point of view of citizens, carers, service users, families and communities will follow in the next phase of our work during 2021, but this is about the workforce perspective. It's also important to say that I'm going to run through the presentation relatively quickly, but please feel free to pause this feedback recording if you want to look at the slides in any greater detail, to read the quotations carefully or slowly. So feel free to use the presentation in whichever way you feel you want to. So just some background information on where we've got to. As you'll know, the impact study is the national evaluation of the Social Services and Wellbeing Act, and we're working as a partnership of universities across Wales to deliver that, led by myself. We've been using the key principles of the Act as the driver for the evaluation study. So voice and control, wellbeing, co-production, multi-agency working, and prevention and early intervention are the key principles of the Act, and our evaluation study is structured around those, underpinned by the financial implications of them. And as I've got on the right hand side of that table, looking at domains, this particular piece of work focuses on the workforce and organisational aspects and the response of those key stakeholders to the implementation of the Act. To remind you that we're using 3 key questions that come from Patton's Principles Focused Evaluation Framework, and this piece of work really is asking that second question: to what extent and in what ways are the principles being adhered to in practice? What we've done previously is to understand a bit more about the principles themselves. So in the Framework for Change report that we wrote for Welsh Government in April 2019, we gave our understanding of the key drivers from the Act for how change would be delivered. The literature review that we've produced for Welsh Government has recently been published, and that goes into some considerable depth again against the key principles of the Act and financial and economic implications underneath it, and the process evaluation is this piece of work. What we're trying to do in this phase of the work, as specified by the Welsh Government, was to understand how the legislation has been implemented, and particularly looking at the role that organisations and the workforce have played in that. So a range of different objectives there. I won't go through those, but as I said at the outset, if you want to have a look at them in detail, press pause and have a read. What we did was to follow our approach, the principles focused evaluation approach that I've mentioned at the outset, and make sure that whatever we did was linked to those key questions, and question 2 in this particular context. We took a purposive sampling approach and in effect collected data via an online pro forma and through speaking to people via telephone, face-to-face interviews and in groups. Really importantly, all of the fieldwork was done, all the interviews and all the focus groups were completed before the coronavirus pandemic and the initial lockdown in March happened. So what you're hearing in the words of the people who participated in the study, this phase of the study, is a perspective prior to lockdown, and we will be picking up the post-lockdown experience in a second phase of interviews and research around the workforce later on in the study. We went through the usual ethical channels as you would expect, and there's detail about that there. And in terms of the analysis, there's information if you want to read that. Important to say that between the pro forma and the interviews that we did, there were approximately 275,000 words that we were trying to rationalise and cut down to go into this presentation. So it's important to say that there's a lot of detail. There's a lot more detail than I've got time to go into today, and that data will be used by the different academics and expert advisors through the project to inform their own work against the themes later on. We've got a particular structure that I'll go through in a moment, and a presentation of findings, largely using people's words to provide an evidential base for the thematic structure that we've identified. Just to go in a bit more detail of how we did it. So as I mentioned, there was a census, a survey of all organisations and networks in Wales. So all of you as members of the Study Expert Reference Group would have received an invitation to take part, and we encourage you to share that invitation with your networks. And we had a relatively straightforward pro forma that people could fill in. We, in addition to that, picked 4 local authority footprint areas to be stratified case studies for us. One was a predominantly rural authority, one predominantly urban, one predominantly valleys, and one predominantly Welsh speaking. So those were our 4 areas, and they gave us contrasting experiences of the implementation of the Act to date. We spoke to people in different levels of each of the organisations in those footprint areas, so strategic leaders and senior managers, operational managers, and then frontline staff and volunteers. And we also wanted to make sure that we spoke to a range of different organisations. So primary amongst those was the local authority and the health board as the statutory organisations, but we also spoke to those that they commission, whether they're in the independent sector or the voluntary sector. And we also engage with people from regional structures that have a role in each of those 4 footprint areas. The third element of our approach was engagement with key stakeholder organisations across Wales, and there's a list of them there. So we've spoken to them to gain a different sort of perspective. You'll note that I've been very careful not to say which of the 4 local authority areas. That's very deliberate on our part, and we'll refer to them as locality 1, 2, 3, and 4 in the rest of the presentation. After each quotation, you'll see which of the levels of the organisation they work for, leader, manager, frontline, which type of organisation they worked in, and which locality they came from. So we've got quotations from a range of different places and a range of different sources, but we deliberately are not saying which of the localities are which. This, and I will really skip over this very quickly, gives you a feel for the kind of people that we spoke to. This isn't definitive, but it indicates the sort of roles. Pause on it if you want to have a look in more detail. The total number of people, the total number of interviews and groups that we undertook in this phase was 100, split in those variety of ways. Across those 100 interviews, 152 people actually spoke to us and gave their perspectives on the process of implementing the Act. And in addition to that, we received 30 responses to the online survey. So what this slide tries to do is give you a feel for some of the similarities and differences between how the data was provided to us by the different localities. So at the top we've got numbers of participants and the proportion of those across the different localities. And then in this table here we've got the series of themes that I'm going to reflect on in the findings section in a moment, laid out. And what we've got against each of those themes for the 4 localities is either a red or a green or an amber cell.
coloured in here. And the purpose of this slide is to try and just demonstrate where we were hearing more things from certain localities about certain themes, and where we were hearing less from certain localities about certain themes. So green indicated where we proportionally heard more about those things from a particular place, and red indicated where we heard proportionately less about those issues from a particular locality. The key message from this slide is that we've got different localities experiencing different sorts of issues, and those are being played out differently across different geographical areas in Wales. This slide gives you an overall structure for the thematic encoding framework that we developed, and this will be the content of the presentation. We structured it around these areas in the slides that follow. So let me take you into the findings. What you'll note on the slides that follow is that we've highlighted in bold a few of the key phrases within the quotations. There's a lot of material in these quotations. We've tried to organise it in as effective way as we possibly can, but as you'll appreciate, there is a lot of depth in the quotations and the comments that people made. So we just tried to highlight the key phrases, but again, please pause and read them in detail as I go through if you're interested to do that. So the first theme related to the actual implementation of the Act itself, and people initially reflected positively about the fact that the Act had enabled new and actually old ways of working. So whether that was about the developmental needs that were required to implement the Act itself and progress through the process of implementing the Act, or in that second quotation, whether it was seen as a welcome return to some of the principles of social work as people felt perhaps had been moved away from, the Act was welcomed. There was quite a lot of preparatory work and planning in readiness for the implementation process, and that was perceived to be broadly effective. People coming together, quite a few briefings about the Act and what it would mean, and importantly ensuring that the information was cascaded out, not just about sitting with a small group, but making sure messages were shared as broadly as possible. In terms of the way in which the Act was introduced to people, it was seen in lots of different ways. Lots of different phrases were used, so as a catalyst to drive and deliver change, but recognising, and this was a trope that came up time and time again, that implementation is a journey. So people were often reflecting on the stage of the journey that they felt they were on. So this person here, I feel that probably we're kind of part of the way through. We're continuing to raise awareness, but we're not at the end of the journey. And there's an awful lot of work still to do. So this quotation down the bottom, it's like a ladder, isn't it, where you keep climbing and the water is coming up behind you, so you're always trying to stay one step ahead of it, was a recurrent idea. The naming of the Act, though, was considered problematic by almost everyone, leading to misconceptions about how organisations' duties and responsibilities would sit, in particular in relation to health. So the actual naming of the Act, the way it was named, was perceived to be a bit of a barrier, especially when not only health colleagues might be perceiving that the Act wasn't anything to do with them, but the reality of social care being delivered by other than social services departments, even though it may be commissioned by social services departments, was raised. There was an issue raised about the lack of public awareness and understanding of the Act as well. So the big change around reflecting on people's strengths and assets hadn't perhaps been communicated as well as possible to the public, because the Act brought in a big change for practitioners, but that had a commensurate change for the public and for service users and their families. So this quotation here about somewhere along the line, very good conversations with the public need to happen around what citizenship means in respect of being self-supporting, being able to maintain themselves in their own homes, for example, rather than just relying on social services departments to pick up. In terms of assessments and understanding what the new role of assessment would be, there was quite a diversity of opinion, and a feeling that perhaps families are not getting what they are entitled to, indicating that respondents felt families perhaps don't really understand the detail of what the Act was trying to do. Moving now to the principles of the Act, specifically thinking about the ideas behind the legislation. There was a consistent view that they form an important values-based framework for action. People really liked the ideas, and the comment that they are becoming pivotal to everything that we do is good evidence of that. Implementing the principles, however, was definitely perceived as something that needs time to work itself through properly. So this is an ongoing and continuous journey of change, and that idea of journey, and as I mentioned a moment ago, was a consistent theme. So this is a process of evolution over time that we're still continuing on, is very much representative of lots of the comment that we heard. We're continuing to progress that thinking. This is still very much live. In terms of the specific principles, firstly on prevention, there were some positive examples of prevention models in practice, but this was often perceived to be quite patchy. It wasn't as uniform as it was hoped it would be. Whether that was because people were being seen too late, their support was being delayed until they were in crisis, as that first quotation has got, or because more positively, there are some places that are using things like local area coordinators to help, but that they weren't uniform, they weren't everywhere, gave rise to the sense of patchiness. There are some mixed accounts, I think it would be fair to say, in the investment around prevention. There were some accounts of very good investment and some accounts of underinvestment. But overall, a recognition that it's really hard, as this person put it, to get ahead of the curve when it comes to prevention. How do you actually get upstream of all of this, particularly at a time of rising need and rising demand on services and austerity? And we'll come back to that theme later on. There were some positive examples on co-production in how that had been implemented, recognising that the new approach had probably brought a very different way of working for partners, and that the third sector in particular had been effective in leading on in these important new ways of working. However, there were challenges identified, particularly in the leadership function. So recognising that co-production is great in principle, but doing it is much more difficult, and making sure that you've got the right people leading the change and driving the change has been tricky, such that co-production, in some people's views, is a principle that remains vulnerable. On well-being, there was a recognition that well-being is absolutely integral to social care, but as a concept is contested and subject to much discussion and debate about exactly what it is. So there's an awful lot of this in the literature and in our literature review. I won't dwell on it too much here, but I like this phrase. So it's so broad, it's almost what we do not mean by well-being that's more important than what we do. And I think that says something, and there's a growing maturity around that, and we'll touch on this when we come to outcomes later on. Enabling well-being, though, does require the implementation of all of the principles of the Act. What people were recognising was that if you were putting people at the heart and asking those what matters questions, then all of the other principles would combine to deliver a well-being outcome. And this was particularly in the view of this person who worked in one of the health boards. Being able to do that with health staff was a really positive development that had been driven by the Act. On voice and control, there were concerns over the fragmentation and overlap of advocacy services. So this is a common theme around advocacy under the Act. Some positives, that there has been an extension of provision across different service areas in the time of the Act's implementation, whereas it was more focused in the past. But there are stark differences in different parts of Wales and across the country. So different areas are doing different things, different provision, and perhaps not always defining things like independent professional advocacy or IPA in the way that the Act envisaged. There are some challenges around direct payments, again, which is a familiar theme across social care and social services. And this tapped into the idea of the citizenry of Wales, people needing to respond differently because of the Act. So this comment here, there's a bit they don't like to tell you about, those are the realities. That's about being the responsible employer, and that people perhaps don't want to be employers, don't want to be entrepreneurial in that sense, often want to have things arranged for them. And that issue came through a number of the quotations, that perhaps there is a shift that we need to bring about in how individual people respond to the challenges of the Act. It's not just about the workforce. In respect of multi-agency working, some excellent examples of how it was working well. So, that is largely a positive, but there is some fragility, gap and inconsistency in, again, how multi-agency working happens across Wales. So there are some challenges there. We needed more integration. We need integration, more integration, and it hasn't really happened. There are still barriers in the system, and it will be interesting to reflect on the experience in the last 6 months under COVID as to how these issues of integration have played themselves out. But where it works best, it's based on trust, relationships, communication, and organizational capacity. So I love this quotation about co-location being an important aspect of this. So they see us, we see them. There isn't anything we can't do together. That can-do attitude, that you put people together, and as health and social care workers in particular, supported by the voluntary sector, there is a can-do. We'll solve whatever we need to. And having those services co-located means in certain communities makes it a lot easier to deliver the kind of integrated multi-agency. Okay, moving away from principles now towards the actual business of the local authority and social services departments. There were quite a few comments made and a discussion around assessments and the new approaches to assessment, which place a much greater emphasis on the strengths and the assets of the individual who is experiencing an assessment of potential need. That was really positively felt by a huge number of people as one of the key drivers of change under the Act. So this is about having more proportionate conversations, about reflecting on the positives in people's lives. And this quotation, it's almost like planting a seed with them, that this new approach allows people to think about what's being said and make a response on their own terms in a way that makes sense to them. However, as always, there are some tensions, and participants were reflecting on the disconnect between the legislative rhetoric, so what the law says, and then operational reality, especially when faced with these ongoing tensions between wanting to be locally responsive, population needs assessment, and all of those aspects, against centralised control of the Welsh Government. So these couple of quotations are, I think, emblematic of that. This first one talks about the location for those assessment decisions. So it's very difficult to have a value-based and asset-based conversation in a ward with 6 other people sat around you, and in effect listening to your conversation. That's not how you do it. That's not what the Act envisaged, but often we are finding ourselves in situations where we have to have those conversations in a place that we wouldn't choose to have them in, and that there is a tension between driving towards consistency in things like systems and paperwork, and having a local version of that. So rather than duplicate it, lots of people will just re-ask you because it's quicker and easier. So there should be one set of questions that's asked rather than and then shared, rather than people needing to answer many times about their own experience. So that was an interesting reflection. In terms of what matters conversations, these were almost universally reflected on in positive terms, seen as a return to good social work practice, putting people right at the heart and having a huge impact. But people having different sorts of conversations with potential service users about what their needs are and what their strengths are. In terms of outcomes, we mentioned this earlier, the contested and subjective nature of them, linking back to well-being as a broader concept, and they're not they're also not fixed or standardized in how they're assessed or collective, so it's quite subjective, I think, is understatement at its best. But that there is a need to think differently about how to collect. So it'd be nice to have one standard system that everybody's using, so at least, if not one precise definition, because people recognize that outcomes did change in context and in situation for everyone. The standardization of the system to record those could be something that was sorted out. So very much work in progress, and the challenge of moving from individual measures to national measures, and the measurement of those things is something that was alluded to as one of those works, as being work in progress. In relation to commissioning, there was a sense of evolution under the Act, but there was considerable progress. So commissioning differently, commissioning for outcomes, all of this is taking time, and it's early days perhaps to have a clarity about the difference that's being made from outcome commissioning as opposed to other forms of commissioning. So that was tricky. And again, this issue of 22 different ways of doing it was raised. It always feels like we're in some sort of competition. This person said, I never quite know what the first prize is and how you prove you've won it. There always seems to be a reason why it's different here. And I think that spoke very strongly to that tension between a central and a local response. In respect of safeguarding, however, the Act was thought to have brought in lots of useful changes. Thinking about adult at risk rather than vulnerable adult was better language, frankly, in the views of very many people, because it's making people think in a different way, which probably aligns better with practice. And the new Wales safeguarding procedures that were brought about recently, last autumn, are now going to be the lever of bringing about change in the view of a number of participants. They are the thing that's going to make us speak differently, talk differently, and work differently, and that they are very well regarded. There's no room for doubt what you have to do. People thought very positively of what these new safeguarding procedures had achieved. Moving now to operational relationships with partners, the importance of leadership to initiate and sustain change was clear through many different interviewees. So having commitment at the most senior levels of the health board and the local authority has been key to making change happen, and needing to maintain that involvement has been an important factor in positive relationships. Reciprocity, has been a key feature of good working relationships. We work together, and working together means that we support each other and we do things, and that there's a willingness to develop relationships not just between health and care, but the third sector as well as a key partner, for example, was mentioned in this quotation, and others have been central to what's worked well. The Act itself is perceived as a driver and a lever for developing partnerships with health. So relationships were good, weren't good, but now regional work in our region is regional. It is about us having a different approach than just the locality one. So, and the Act has been a driver. So after a few years of fisticuffs and falling out, we're now beginning to pick the pieces up and work differently. The Act has therefore enabled the integration of social care and health to develop in a lot of different aspects. So strong regional approach, very collaborative, and without that, the integration agenda wouldn't have been as advanced as it is in the view of a number of our respondents. Time and resource, however, are required to help build those effective partnerships. So put in community care about 6 or 7 years ago, and there's a detail in that quotation about how that relationship has had to grow slowly over that time. People perceive that the voluntary sector on the whole is an excellent partner, but there are some concerns over capacity, funding, and therefore sustainability. So cycles of time limited pots, you've only got so long to spend the money, it's not allowing you to plan the programme as well as you would want, and perhaps stymieing some of the positive outcomes that might be achieved from those sorts of programmes. There are, however, persistent and competing cultures of different organisations, especially between social care and health, that need to be further reconciled before the integration, as envisaged by the Act, is achieved. So there is grounds for hope here, but relationships are not really where we'd want them to be because of the different cultures, and challenges about medical model thinking as opposed to social model thinking persist in the interviews that we had with people. So these processes are indeed a process, but they are not realized or achieved to their fullest extent just yet. In terms of more strategic relationships with partners, and thinking about some of the bits of infrastructure, if you like, that the Act has brought in, boards and structures are perceived to have been a key aspect in formalising and strengthening partnerships across the 4 localities in particular that we did the research in. So living the Act, if you like, is about what it's about. That's what it is. We want to be able to work together strategically along the lines of the Act. That's what's driving us. Was the words of this respondent, I think, quite powerful words. Regional safeguarding boards were especially viewed as positive, so this has been nothing but a good development in a variety of different ways. Accountability, making sure that policy development, etc., has been a positive. So regional safeguarding boards thought of very, very well, and ensuring that there's a legitimacy to the work that was there, that wasn't there before, is now there in the view of this respondent. However, Regional Partnership Board and the Public Service Board, these 2 key aspects, one under the Social Services and Wellbeing Act and one under the Wellbeing and Future Generations Act, are not optimally working, and the relationship between the 2 of them needs to develop. Partly that's about understanding the blurring of some of the boundaries, but also making sure that the right people are attending and making their commitment to both of those boards. Following on from that, the size of some regions and the variation within that geography is presenting challenges to in-depth discussions particularly about health and social care integration. So the RPBs are very, very large beasts, and because of that, getting into meaty discussions about the future shape of health and social care, have we been as successful as we want to in achieving that? Not sure. And the size doesn't help. The size of representation on the boards as well is an issue. So I love this quotation: you've got more than a squad and a set of reserves in the room, haven't you, really? So there are, in the drive to try and be inclusive around those board tables, perhaps the functionality and the accountability of those boards may have been compromised. And finally, on strategic relationships, applying a one-size-fits-all region approach is problematic. It's not going to work. Different footprints are needed for different issues. So thinking a bit about the RPB, PSB type debate, is that going to work itself through positively? There are some questions about that. But one-size-fits-all isn't going to work for Wales. And it's also having a proper understanding of the drivers for a variety of organisations, not just about social services. It's about what our partners and ourselves and third-party agencies are all wanting to get out of joint working. In terms of the workforce, managing and developing social workers and the social care workforce more generally is an ongoing process as perceived by respondents. So the change that the Act brought about was quite a big one for some. Some get it immediately, but the majority of staff don't get it immediately, and then there's some who will never get it. And recognising that and what that means for workforce culture was an important realisation that came through the interviews. So it requires a lot of training, a lot of support, and that's the challenge of a piece of legislation like this, is to change the culture. And it therefore is a landmark for a generation. People saw this as a long-term process of change, not something that would be done quickly. Crucial to that, though, was the provision of support from leaders and team managers in the further development of the Act. So really important to have that support all the way through, championing and making a difference. And all of that has to be seen, however, though, in a very difficult context for the workforce. So increasing caseload, decreasing capacity, pressures of demand, are huge rate limiting factors on this journey that people were talking about. So the incessant demand in the system, the complexity of demand in the system, having to devote every penny that we've got plus more, it isn't about the lack of strong prevention. It isn't because there's no co-production. It isn't because there aren't individuals and families that are going to be potentially walking towards them. All of those things are in place, but they could be better. But this is just about the volume of demand. The volume keeps rolling and rolling and rolling, and that's something that this person was saying they could see before their very eyes, de-energizing some of the very best people, and that was a very difficult thing to hear through the interviews. And similarly, in this quotation about people leaving, so the pool of qualified staff that people are looking to employ is smaller and smaller because people are opting to work in less stressful fields. This particularly a comment about children's services as opposed to adult services. In terms of data, there were some positive thoughts issued about the shift from more quantitative data collection to more qualitative forms of data collection, being obviously in line with what the Act envisaged, but also in line with practice. So understanding what's impact is not a numerical reductionistic thing. What's impact and what's the evidence of that impact? Well, the view was, I think, quite universally expressed that that's easier to make sense of through story and through more qualitative forms of data than quant. The Act is prioritising the focus on individual outcomes. That's, again, a very, very positive thing. It's not just quantitative. It'll involve case studies, stories, pictures, all of the forms of more what might be described as more soft data was an important feature of the process of implementing the Act. However, as always, some frustrations that the systems, there are of course some frustrations in the system, particularly around the data management systems and the Welsh Community Care Information System, WCIS. It would be great to have that working as efficiently as possible in the views of our participants, but it's not quite there yet. So challenges to capturing and evidencing data around uncertainty, how best to do it, difficulty in attributing positive outcomes, and learning to use WCIS and other systems effectively were common themes that came through. And last theme in our findings around the financial and economic implications of the Act. So this all happened at a very difficult moment for public service, and that's putting it lightly, right in the middle of a period of austerity. So this person, since I've been here, I've been pushing for savings. That's all I've done in 4 or 5 budgets, was very representative of the feedback around the financial climate, at which point in time the Act came in and the changes that were required by it were beginning to be implemented. So negative impacts of austerity and financial pressures linked to overspending within social services and a reduction therefore to the statutory provision of services in some places, controlling demand and lowering expectations across the piece in local government and managing those competing demands was an identified challenge. And short-term funding came up time and time again as one of the major factors that was getting in the way of beginning to do some of this work effectively. Pooled budgets, because they were required, one of the required elements as part of the implementation process more broadly, came up and came in for some criticism. It doesn't mean anything, doesn't actually mean anything. We're just playing silly games, moving money around. If we're going to do this properly, let's do it properly, but we're not there. There are battles across our different relationships, and this isn't really working, was the view expressed. The short-term funding I've mentioned, and just to give a bit more detail about that, the lack of sustainability and stability that short-term funding arrangement gives was the primary concern. It builds anxiety in terms of staffing because of the short-term nature of contracts, but also the opportunity cost involved in servicing those grants. So in this person's view, I don't want to get into a situation where we're applying for 6 or 12 months of grant because it just takes up time to get that money in and then monitor that grant and provide the feedback on that grant. And does that deliver best value for people was questioned. ICF was broadly positive. but it could have had greater impact if it had been better planned. And there are recommendations in there from our participants about the fact that you might get bigger projects, you might get better projects if it was more organised and the timescale over which the funding was available was extended. And that finally, savings were also linked to the positive impacts from working alongside the Act. So finishing on an up note with an emphasis on partnerships and sharing the burden across different organisations. So that following the money and following the impact was an important aspect of the conversations that we were having about prevention and where the benefit of prevention rests. So who gains from the savings, and the recognition in this person's point of view is that it's very difficult to know that. You can't tell where someone's life would have been. You can't make assumptions about that. But if you can do the right thing for that person, then you're doing the right thing for the system. So just to bring this to a conclusion with a few thoughts at the end of this presentation. That carer service users, communities and families, as I said, haven't featured. That's the job for 2021. But there are a series of questions that emerge from this work that we'll carry forward into that phase. We spoke to a few people or had conversations around the fringes of the substantive field, but with some carer service users and others. So those questions there, we're taking forward as a checklist as a start for the field work that we'll do extensively with carer service users and others into 2021. That this is complex and potentially contradictory. This is a huge evidence base. It doesn't go in a straight line. It doesn't tell a simple story, and it contradicts itself at many points. In lots of ways, that's our job now to deal with that complexity and make sense of that complexity, but that's where we're at. And the third thing I want to leave you with is a few conceptual thoughts. That there are ways of conceptualizing this data that we're beginning to think through. So I'm just going to present you a graphic that identifies four different forms of practice, if you like, which have to a larger or lesser extent required different amounts of change and different amounts of implementation. So this slide tries, as I've suggested, to conceptualize the data that we've received so far. So the logic behind this is that across the top here, we've got all the forms and domains of activity under the Act that we've heard about, all on a journey moving from one form of practice to another, recognizing they're not quite there yet. So if you like, that big solid red rectangle represents the totality of activity across social services in Wales. And there are two other axes that matter. One is the amount of change that's required in order to deliver against the Act's requirements. So at the bottom of this diagram, we've got things that require least change, and towards the top of this diagram, we've got things that require more and most change. And there are two domains, if you like, within which that change is being played out. We've got forms of activity and practice that basically are continuing on from something that existed before the Act. And we've got forms of practice that, in order to meet the duties and requirements of the Act, require an element of transformation. And there are four shapes on the diagram that I'm going to talk to you about. So the one that requires least change and is a form of continuation of practice is this first one here down the bottom, which we're calling continuation pre-aligned. What we mean by that is there are a range of respondents who mentioned that they were already doing what the Act outlined when the Act came into force. So they were pre-aligned with the Act's requirements ahead of the implementation date. So whether those were in reablement services or forms of practice like signs of safety, there was a degree of pre-alignment with what the Act required. So required very little change for them to meet the duties. The second form of activity is what we call continuation acquiescence. So this required a bit more change to meet the requirements of the new Act and required people to move somewhat reluctantly on occasions to new forms of practice as required under the Act. This might have been around data systems like Wikis. It might have been about a change in commissioning practice to a more outcome-focused way of working. But people acquiesced from one form of practice to another under the Act, but not necessarily with joy in their hearts always. The third form of continuation activity, though, is one where there was much greater enthusiasm. So what we're calling absorptive practice, where people were keen to adopt and embody these new forms of practice that the Act was requiring. So this was a much more positive sense of change, continuation with the way things had been, but a more positive sense of adopting and absorbing new ways of working. So maybe around IPA, for example, in advocacy terms, that was seen to be quite a positive new development that people were keen to embody. Similarly, what matters conversations and strength-based forms of assessment fall into this category in our conceptualization. Then we've got this divide between the continuation forms and the transformation forms indicated by this line that goes all the way down the diagram here. And across that divide are the things that have required most change, largely because they didn't exist before the Act came into being. So transformational forms of practice that are in this box are the ones that have required people to make the most change from what they were doing prior to April 2016. So these are brand new forms of practice or brand new bits of infrastructure under the Act. So regional partnership boards, information advice assistance service, the What Matters conversations as part of strengths-based assessments were all brought in new under the Act. What we remain to understand, and we'll see how this works in the research we do over the next couple of years, is the extent to which these are transient forms of transformation, so they come but then they go, or whether they are more permanent forms of transformation, they come and they remain. So that is a way of conceptualizing some of the complexity that we've seen in the data analysis that we've done to date. So finally, just to leave you with some more words, but words I think that hopefully will resonate and summarize everything that's come before. Needing the space to think about whether what we're doing is the right thing. If it isn't, needing to have different conversations and difficult conversations. People questioning whether they're taking the difficult strategic decisions at the right time. Worrying about the clinical leadership base in hospitals as a potential barrier to change. Talking about a new culture of working on the integrated basis that the Act requires. Difficult to have the evidence base. It's not scientific, but questioning whether we're measuring apples with apples yet. Dealing with the conflicts that the Act requires to be dealt with between the individual and the family on occasions, and between the workforce and the family on occasions. Questions about whether the information that fills in and takes so much time to fill in on forms is actually used meaningfully. And this last quotation, I think, is very emblematic of the kind of feedback that we got. So the system is inclined to work to the quickest solution for very, very good reasons, but that's not necessarily the best solution for people's well-being, and really the job of implementing the Act is all about reconciling that tension.
Wel, diolch gymaint am wrando y cyflwyniad. Thanks so much for listening to that presentation. I know it was long. Hopefully you were able to maneuver your way through it as you wanted to. Gobeithio bod eich chael yn ddiddorol. I hope you found it interesting. There was a lot of really powerful messaging that came through that phase of our work, and as I acknowledge at the end, we'll be taking a series of questions from that into the part with citizen service users in 2021. I'm hoping that as part of an email where you've seen this link, you will have had the invitation to one of 3 sessions that we're running in October to provide feedback. The idea of having the presentation today was that you would have the opportunity to have watched it ahead of time, so we don't have to take up time in the meeting talking about the findings, and what we can spend our time on is getting your views and feedback on them. So I hope all of that is clear. Look forward to seeing you in a couple of weeks, or a couple of days, or a couple of minutes if you're just watching this before the meeting time, and catching up to get your views then. Diolch am fawr I chi gyd. Thanks everyone for your time.